Good afternoon, Chairman Frank and members of the committee. I am Ann Dunkelberg, Associate Director at Center for Public Policy Priorities and Director of the Health and Wellness Program there. And I'm here to testify in support of the bill. I want to join my other colleagues and stakeholders in thanking Representative Cortez and Representative Rose, and now Representative Davis, I gather, for bringing forth this legislation. Those of you who aren't familiar with my organization, Center for Public Policy Priorities, we were founded in 1985 by the Benedictine Sisters of Bernie, and to work on healthcare access in Texas. And we work on some other issues now, but healthcare is still my beat. And we try to focus on the use of data and evidence-based practices in our work. Eligibility policy just happens to be, and how it affects enrollment and access to care just happens to be something that's been part of my job for over 20 years now. This is a very simple bill. If you've looked at it, it just changes one word. The eligibility policy behind that is somewhat more complex than the bill text is. As Representative Cortez has told you, one of the main goals here is to get parity between how we treat the higher income kids in CHIP and how we treat the children in our Medicaid families with a 12-month continuous period of eligibility. The process that the author described was implemented in 2014, and we feel like it has had unintended consequences of resulting in eligible children losing their coverage. Some of the things that brought us to that concern, in addition to the uninsured rate that he mentioned, that unfortunately we had an uptick in uninsured kids from 2016 to 2017 in Texas, and we're seeing a little bit of a decline in the actual program data in our enrollment of kids in Texas. So those are things that have concerned us, and the agency has recently provided analysis that did in fact reveal that for all of the kids that they were removing every month because of these periodic income checks that Representative Cortez mentioned, that over 9 out of 10 of them are actually being removed for paperwork reasons. Somebody didn't get the proof they needed to back in time, and only about 4,100 kids a month were losing coverage, and fewer than 400 a month were actually over income. So again, it may have had a good intention. It's not working the way it was meant to. Oh, and I forgot to give your clear testimony. This handout has most of the statistics that are in my remarks. It's not verbatim my remarks, but includes those statistics. So they reported to us that about 47,000 kids in 2017, about 53,000 in 2018 had lost their coverage as a result of those.
Okay.
I think you've seen the fiscal note. We're glad to see that it's considerably lower than had been calculated in previous years. It does show, for one thing, the offset of premium tax revenues that are always a part of getting more coverage in Texas. There are other offsets that we discussed with the agency, and we really appreciate the attention that they applied to the fiscal note. Happy to answer any other questions.
Okay. Members, any questions? And so I guess just to be clear, there are 400 that had the income high enough to where they should not be covered, should be on other insurance, and then the others were not. When you said I guess they have paperwork, they're going off because of lack of paperwork. Is that literally not turning in something, or they can't prove they don't have?
It could be a combination of both.
I'm actually going to call. I'm going to give you a chance to answer that, but I am going to ask Gina Carter to come up next, resource witness.
So basically, obviously, in continuous eligibility, like kids have in CHIP, there's not an obligation to change your status until you come up for that 12-month renewal. That's the same thing you and I have. We don't have to renew more than once a year. In these periodic income checks, they're going into a child's case, looking at third-party databases, and if they find something that indicates a possibility that a family might be over income, which sometimes could be a database that still hasn't deleted mom's last job but shows her current one, and so they want you to prove that you're not working 2 jobs now and making twice as much money, those kinds of things. And because they are sending them currently in months 5, 6, 7, and 8, families can often get confused. They've responded to something that came in month 5. They're getting another request in month 7. They think they've already answered it, so they ignore it. So a lot of it really is that we have a fantasy that we'd like to be able to, automatically detect people's income and then immediately move them to the right program, but the system just doesn't work that way.
So if the system could catch the 400 without bothering the 2,000, would you like that, or should it just be
4,100?
Or 4,100, I'm sorry.
Yeah, so it is 9 to 1. I think if a system like that existed, I would consider it, but 12 months of continuous eligibility is the best practice. If it's good enough for our kids in CHIP, why would we not be doing it for our kids in Medicaid? This is when we first adopted the policy that was in place from 2012 to 2014 for our kids. It was the result of bipartisan support in the legislature for making sure we weren't using red tape barriers to reduce the caseload.
No, and
these are eligible kids.
Totally agree with that. Yeah. The idea that best practice is we put them on and keep them on is a little bit concerning. I totally agree with the removing red tape and not removing people.
Our problem is
the idea that, hey, let's put them on and leave them on as long as we can is a little bit concerning.
But I think, if it's okay for CHIP, we feel like it should be okay for Medicaid as well.
Right, which doesn't necessarily mean, so.
The only other thing to say is that many families that are in the, a lot of us would like to think that there aren't families that work full-time and are still in poverty, but there are. So that's who a lot of these kids are. And for a lot of them, that means multiple jobs, hours that change every month. And so those are the kinds of things that can really make, constantly having to document your income a real burden for a really hard-working family.
We do not want to punish people for working, absolutely.
Yeah.
Yes. Dr. Hinojosa.
Can you speak to the point about best practices? Like, what do you mean by that?
Well, basically, the federal government has, for over a dozen years, encouraged states to adopt 12 months. They don't force them. So we have a pretty strong ethic in Congress of not forcing a lot of Medicaid changes on the states because the states are ultimately going to have to carry part of the share. But since 2009, in that reauthorization of the CHIP program, they promulgated a policy to encourage states to move forward and to adopt 12 months continuous eligibility for kids.
Okay, thank you. Members, any other questions? All right.